Great, thank you, Mike. So I'd like to start with a riddle that a lot of us are familiar with, and that's if a tree falls and nobody's there to hear, does it make a sound? And that philosophical riddle really raises the question between observation questions and questions of knowledge of reality. The National Cancer Institute funds a forest of amazing research. And with the National Cancer Act, we actually have a mandate to disseminate all data useful in the prevention, diagnosis, and treatment of cancer. But what we're seeing more in the literature is this question. And really, it's more about what does it really take to move evidence-based research, in this case, the trees within that forest, to really move it into everyday practice. And so in 2003, NCI, in collaboration with our national partners, developed Cancer Control Planet, which really is a one-stop shop for cancer control practitioners to plan, implement, and evaluate evidence-based programs. To support Planet, the NCI Cancer Information Service Partnership Program really provided, were basically our dissemination arm on the field to raise awareness about the tool, but to also work with local cancer coalitions to implement evidence-based programs. However, that program ended in January 2010, and so we were back to this static website. So we came back together to try to develop innovative strategies to bridge research and practice. And one of the things that we came up with was to build a virtual community of practice. And we did this in a stepwise approach where our first stage was really to create an environment where we could foster collaboration and dialogue between researchers and practitioners. And the first thing we did is to launch our monthly cyber seminars in January of 2010. And this has been a tremendous hit. Since the cyber seminars launched, we've had nearly 8,000 registrants, about 3,500 participants, and half of those participants are return participants to the cyber seminars. In addition, the web traffic on Cancer Control Planet substantially increased in both total web visits and unique web visits, but also our listserv membership had a huge jump from 850 to about 4,500 new members on the Planet listserv, and this is just within the first year and a half. So our second phase is really to develop a platform where researchers and practitioners can collaborate, share ideas, ask questions, and we developed this website called Research to Reality that allows just that. And the website launched in February 2003. We have about 425 members right now on the site, averaging about 6,000 page views per month. And most of the discussions are around the cyber seminars. But we really think that the discussion section is the hallmark of the site. And this is where we think that connections are going to be made, that resources and solutions are going to be shared, and more importantly, issues are going to be solved. Looking ahead, we're about to launch the Research to Reality Mentorship Program, which really follows a mentor-mentee pair into navigating that complex real-world setting in which evidence-based public health decisions are made. And so just returning back to that riddle that I started with, we hope that R2R, Research to Reality, provides a platform for the best research to be heard, but to also integrate the what-if questions that allow us to know if the interventions work with the everyday knowledge or the how-to questions of everyday knowledge to make a greater public health impact. And just a thank you to the rest of our team.